In this video, I will give advice about COVID-19. The COVID-19 pandemic is far from over. To date, nearly 175 million people worldwide have been infected with COVID-19 and more than 3 million have lost their lives. Coronavirus or severe acute respiratory syndrome coronavirus 2 is a collection of viruses that attack the respiratory system. The disease caused by infection with this virus is called COVID-19. This virus can attack anyone, like babies, children, adults, the elderly, pregnant women, and breastfeeding mothers. The COVID-19 infection was first discovered in the city of Wuhan, China at the end of December 2019. This virus spread quickly and spread to other areas in China and most countries in the world, including Indonesia. This has made several countries implement lockdown policies to prevent its spread. It is suspected that coronavirus was originally transmitted from animals to humans, but then it was discovered that the coronavirus was also transmitted from human to human. A person can get COVID-19 in various ways, including 1. Accidentally inhaling droplets of saliva that come out when a person with COVID-19 coughs or sneezes. 2. Holding your mouth, nose, or eyes without washing your hands first after touching objects that have been splashed by the saliva of a COVID-19 patient. 3. Close contact with people with COVID-19, for example, touching or shaking hands. The COVID-19 virus can infect anyone. The effect will be more dangerous if it occurs in the elderly, pregnant women, people who have certain diseases, or people whose immune system are weak. So what are the symptoms of the coronavirus? 1. High fever with chills, dry cough, have a cold, runny nose and sneezing, sore throat, hard to breathe. Symptoms of the coronavirus can get worse quickly and cause respiratory failure to death. Viral infection can appear anywhere from 2 days to 14 days after exposure to the virus. Who is at risk of contraction of COVID-19? That is people who live or travel in areas with the COVID-19 virus circulates are very likely to be at risk of infection. Those who are infected are the people who, in the 14 days before symptoms appear, have traveled from an infection country or close contacts, such as family members, co-workers of medical personnel who cared for patient before they know the patient was infected with COVID-19. How can humans be infected with COVID-19? A person can be infected through small droplets from the nose or mouth when coughing or sneezing from a COVID-19 patient. The droplets then fall on surrounding objects. Then if someone else touches an object that has been contaminated with these droplets, then that person touched the eyes, nose or mouth, then that person can be infected with COVID-19. How to prevent coronavirus transmission? Some ways that can be done to prevent the transmission of the virus are 1. Providing the COVID-19 vaccine which is currently running in Indonesia. 2. Maintain health and fitness so that the body stamina remains excellent and the immune system increases. 3. Wash hands properly regularly using soap and water or an alcohol-based hand sanitizer. 4. When coughing and sneezing, cover your nose and mouth with a tissue or the inside of your upper arm. 5. Avoid contact with other people or traveling to public places. 6. Avoid touching eyes, nose, and mouth. 7. Use the mask properly to cover your mouth and nose when you are sick or in public. 8. Dispose of used tissues and masks in the trash properly, then wash your hands. 9. Postpone travel to regions or countries where the virus is found. 10. Avoid going outside when you feel unwell, especially if you have a fever, cough, and difficulty breathing. Always monitor the progress of the COVID-19 disease from official and accurate sources. Follow direction and information from health workers and the local health service. Information from the right source can help you protect yourself from the transmission and spread of diseases. That's all the COVID-19 appeal from me. Sorry if there are mistakes in speaking. Wassalamualaikum warahmatullahi wabarakatuh. Stay safe, guys.